Hey guys, it's Dr. Zach, your Roseville chiropractor. Today we're going to do something a little bit different. We're going to start a new segment that's called Ask a Chiropractor. And today we're going to go over a question that I've been asked a lot, and that's if we should self-adjust our back or neck or whatever part of our body, if we should, or self-crack it in any way. Without further ado, we're going to have Dr. Scott Owens, another chiropractor at Accident Sports Injury Clinic, talk about if we should be self-adjusting or self-cracking our back or neck. Hope you enjoy the video.
One of the really common questions I get is whether or not it's okay to crack your own neck or your back, doing some self-adjusting or manipulation to yourself. We oftentimes tell the patient that manipulation is fine as long as we're moving the segments of your spine that need to be moved. Every section of your spine or each vertebra should move individually. And when we check a patient, we're checking for the segments of their spine that are not moving correctly. And then we're specifically moving those particular sections. When you're self-adjusting, you're just randomly moving things. In fact, the segments of your spine that are the loosest are going to move first because it's really the path of least resistance. And people are forcing it one direction, pushing. They'll oftentimes, and those of you who do it, if you think about it, you'll notice that you can get one side to move really good, but not the other side so much. Some of you get both sides moving, but you'll get different areas moving than maybe need to be moved. So it'll feel good for a while, but in the long run, you're really creating an imbalance between very stiff segments of your spine and very loose segments of your spine, which in the end will cause more problems than necessary. So it is okay to do some light stretching, and if you get a little movement or there's a little cavitation or a little popping that happens there, that's not a problem. It's when you're forcing your neck or your lower back in a position, you're arching over something where you're just trying to force it in one direction where it necessarily may not need to go. I hope that helps out.
Thanks for watching the video today. If you have a question that you want us to answer on our next Ask a Chiropractor segment, just make sure they comment below and then we'll try to answer your question for you. Hope you have a great day.